All right. Well, it's 1 after. I want to be respectful of everyone's time. So again, good morning, good afternoon for all of you joining. It's wonderful to see some familiar names and faces and to see some new names and faces joining us today. So thank you for that. We're going to learn a little bit about ebb and flow strategies for minimizing flow rate variability with syringe pumps prior to dispensing infusions. I am your moderator, Debbie Child. I'm a Global Medical Affairs Associate Director here on the medical team, and Jackie Cole will be speaking today. Before she takes over to give us this very important education, a few housekeeping tips. We appreciate and value all of your questions. Please use the Q&A chat to send those in, not the chat box, I'm sorry, but the Q&A. So please submit your Q&A questions. We will work through as many of them at the end of the presentation as possible. And while we're doing that, we will have a QR code on the screen with a webinar participation survey link. Again, we appreciate your feedback. We really want to make these sessions as relevant and meaningful for you and your practice as possible. And we welcome all of your feedback, both constructive and supportive, as well as other topics you would like us to teach more about in the future. And with that, I will turn it over to Jackie to, again, discuss strategies for minimizing flow rate variability with syringe pumps.
Thank you, Debbie. As Debbie mentioned, my name is Jackie Cole, and I'm a Senior Principal Medical Liaison with Infusion Therapies and Technologies with Baxter Healthcare Corporation. And my only disclosure is that I am an employee of Baxter. So our learning objectives for today and for our next webinar are to list factors that can cause variation in flow rate with syringe pumps and to discuss strategies to promote flow rate continuity with syringe pumps when preparing and administering infusions in syringes. And the reason we're presenting this topic on flow rate continuity with syringe pumps is that even though it's been almost a decade since the FDA issued a safety communication on flow rate continuity issues with syringe pumps, it bears highlighting again because the information is still relevant and not widely known. So more on that shortly. So a question to begin the presentation. As a pharmacist, let's say you receive an order for a continuous infusion vasopressor that is for a 2.5 kilogram patient in the neonatal intensive care unit. Which factors should you consider prior to dispensing the syringe, which will be administered via a syringe pump? A, the concentration of the medication infusion. B, the infusion flow rate associated with that ordered dose. C, the syringe size and brand. Or D, all of the above. Feel free to enter your answers in the chat. Great, we see the theme here that all of you are getting the answer correct. It is D, all of the above, and these are some of the concepts that we'll be discussing today. So this will be a series of 2 webinars. Today, the first webinar, we're going to talk about factors that influence flow rate consistency before you dispense a syringe. So it's fairly pharmacy-centric. And the second webinar, which will be held in May, is going to be looking at factors that also influence flow rate consistency, but at the initiation and during syringe pump infusions. So it will be more pertinent to end users and nurses, but both nurses and pharmacists will find both of the webinars valuable. And we're intending to deliver the information in smaller bites. So we're aiming for about 30 minutes of content with about 10 to 15 minutes for a Q&A. Both webinars will be recorded and they'll be posted on our medical education website. There's a QR code for it there, and I'll show this slide again at the end of the presentation for your viewing. So let's begin by comparing large volume pumps with syringe pumps. So large volume pumps, as you likely know, deliver fluids, medications, and or blood via intravenous or epidural routes. And they're more accurate than manually adjusting rates when giving pure gravity administration. And flow rate ranges from 0.1 to 1,500 milliliters per hour. and accuracy is generally established to be plus or minus 5 to 10%. And the mechanism for large volume pumps are either a peristaltic or cassette pumping mechanism, and they're used in both adult and pediatric patients. Syringe pumps, on the other hand, deliver all of the same types of fluids with the exception of, skipped ahead there, they may have indications for enteral fluid administration as well. And they're designed to accurately deliver fluids or medications in small volumes, less than or equal to 60 mLs, and at low rates of half to 10 milliliters per hour. And their flow rate ranges from 0.01 to 1,200 milliliters per hour for syringe pumps on the US market. Their accuracy is better than large volume pumps, established to be between positive to minus 2 to 5%, but it is very syringe dependent, as we'll discuss shortly. And they all tend to have the same mechanism, which is a stepper motor and lead screw. And they're used by anesthesia, neonatal intensive care units, pediatric patients, fluid-restricted adult patients, oncology, any of these locations where you want really accurate fluid delivery at low rates. So let's begin by learning about how syringe pumps work so you can understand how its pumping mechanism can affect flow rate continuity, keeping in mind that this mechanism applies to most syringe pumps. So here we have a graphic of a syringe pump. Syringe pumps have a stepper motor and gearbox. We have it here in the graphic in the front of the syringe pump. This motor and gears turn a lead screw. Here's the lead screw, which causes a nut to move along the lead screw. So think of this like a nut and bolt. So if you hold a nut and bolt and you turn the bolt, the nut will move along that bolt. In a syringe pump, that nut is attached to a pusher block that holds the plunger. When the lead screw turns, the nut and pusher block move forward, which propels the plunger forward. And when you move the plunger forward, it's going to push the fluid out of that syringe into the tubing and ultimately to the patient. Now, at low programmed fluid rates, it's going to take a while for those gears to engage, and that lead screw is going to begin to turn very slowly. So therefore, it's going to take more time for the fluids or medication to reach the patient, especially if the tubing has not been primed from the pump. But at higher program rates, that engagement occurs quicker. So let's look at how this affects fluid continuity. When you program a syringe pump infusion at 1 milliliters per hour, for example, what you expect to see is a stable infusion at that rate shown here by the purple line. But because of the syringe pump mechanism, the characteristics of syringes, and the low flow rate, what you actually see is a period of time before that infusion reaches the desired rate, shown here by the red actual rate line. And this is referred to as a startup delay. How long that delay takes can be dependent on the rate. Lower rates are going to cause longer delays. The syringe size, larger syringes, especially at low rates, are going to cause longer delays. And whether or not the tubing has been primed using the pump's priming feature, whereas by priming via the pump engages those gears quicker and results in more consistent flow quicker. You'll also notice that in my exaggerated drawing, that the actual flow rate is sort of like small boluses and pauses, which is again related to the syringe pump mechanism. And the faster the rate, the less pulsatile and more smooth that flow rate becomes. So think about this like riding a bike. When you first start to pedal a bike, it's not smooth and it's hard to balance. But as you pedal faster, the ride is smoother, it's more consistent, and you feel more balanced. The FDA recognized that flow rate continuity is a challenge at low flow rates, and they issued a safety communication in 2016 entitled, "Syringe pump problems with low infusion rates can result in serious clinical consequences." And the FDA shared this communication with syringe pump manufacturers, and they asked them to share with customers as well as to update any labeling to inform users of flow continuity concerns. So in their communication, they stated that there was a lack of flow rate continuity at low rates, less than 5 milliliters per hour, but especially when less than 0.5 milliliters per hour. And this could result in delay of therapy, overinfusion, or underinfusion. And even small changes in flow continuity could result in large deviations in the administered dose. And this was evident by the adverse events that were reported to the FDA. And these adverse events included reports of unstable blood pressure, anxiety from loss of sedation, and increased pain indicators in critically ill infants with low flow rates. So the FDA concluded that the benefit of syringe pumps outweighs the risk, but that users needed to be aware of this information. And although the safety communication was issued in 2016 and applies to all syringe pumps, its content and recommendations remain relevant today because syringe pumping mechanisms still consist of a stepper motor and lead screw, and not all healthcare professionals who use or manage syringe pumps are aware of this information. So let's take a closer look at factors that influence startup delays and flow rate continuity. Startup delays are influenced by mechanical slack, stiction, and compliance. And mechanical slack is caused by any type of gap in the syringe pump system. So for example, if you don't load a syringe properly, there could be a gap between the top of the syringe plunger and the plunger driver head. So when the syringe pump is turned on, it's going to take some time for that plunger head to come in contact with and engage the plunger. And this is why it's important that the syringe is properly loaded in the syringe pump and that it's in contact with all areas of the pump that it should be. It can also take some time, as we mentioned, for those gears to be engaged at low rates and to begin smoothly turning. So priming from the pump can engage those gears quicker and decrease that mechanical slack. Also, when a pump is started, it initially has to push against any downstream pressures like pressure sensing discs, back check valves, or filters until that pressure is equalized. Stiction is the sticking and friction between a syringe plunger and barrel. And you've probably felt that yourself if you've ever tried to pull back on a syringe plunger and or remove it from a syringe. And you've also noticed that that stiction is more prominent with larger syringes. So they have more stiction than smaller syringes. And this is especially true with bigger syringes and lower flow rates. Compliance is syringe and administration set expansion and contraction due to pressure. And compliance is related to the elasticity of the syringe and the compressibility of that rubber stopper. Plastic syringes can swell when pressure is exerted in the syringe. You're not actually going to see that, but it can occur to a degree that affects the flow. Now you see here, I have a photo of a plunger with a rubber stopper from a large syringe. And if you've ever removed a rubber stopper or a syringe plunger from a large syringe and you've pushed on that rubber stopper, you've noticed that it's compressible, and that's because there's a pocket of air in that stopper. And rubber stoppers in larger syringes are considered more compliant, meaning they contract and expand more, because that pocket of air within the stopper has to be completely compressed before the stopper can begin to push fluid forward. Smaller syringes are less compliant and they have more rigid stoppers, so they can push fluid forward sooner. So it's not the traditional definition of the word compliant that you might be thinking of, because in this case, something that's more compliant is bad and something that is less compliant is good when it comes to flow rate continuity. Syringe pumps must overcome all of these forces, and they have to compress that rubber stopper before the delivery of fluid can occur. And startup time depends on flow rate and syringe brand and size. Large syringes, typically greater than 5 milliliters, and low flow rates, typically less than 5 milliliters per hour, are going to cause longer delays when you're starting infusions or changing the rate of infusion. So you're going to hear a theme here of large syringes and low flow rates causing flow rate issues. So let's take a closer look at syringe-related factors. Syringes are designed by syringe manufacturers for manual use, not for use in syringe pumps. So syringe pump manufacturers perform extensive testing on syringes to determine how they perform in their syringe pump at a range of rates. And performance is going to vary by brand of pump, brand of syringe, and according to the size of the syringe. And the testing performed by the syringe pump manufacturers determines what the minimum recommended and minimum programmable flow rates are for various syringes and whether or not they perform to the standards that result in them being approved for use. So the minimal programmable flow rate, shown here in the far right column, is the lowest rate at which a syringe pump will run. So it will not infuse at rates less than the minimum programmable flow rate. And the minimum recommended flow rate, showed in this column here, is the rate at which you can expect to see minimal variability in flow. And this is especially important for continuous infusions of medications that are high alert, have short half-lives, and or vasoactive, because these are all scenarios when you want consistent flow rates. So how do you know what the minimal programmable and minimal recommended flow rates are for a syringe pump and for the various brands of syringes and sizes? So they should be listed in the syringe pump operator's manual, and you should always refer to your operator's manual for these specifications. And if you're wondering now where to find a copy of your operator's manual, you could probably check with Biomed and or your syringe pump manufacturer. How does a nurse know if he or she is programming a syringe infusion below the minimal programmable flow rate? Well, the pump is not going to accept that programmed rate, and the nurse will not be able to start the infusion. How does a nurse know if he or she is programming a syringe infusion below the minimum recommended flow rate? Well, the nurse may or may not receive an alert on the pump, depending on the brand of pump. So this is why it's so important to assure that the appropriate brand and syringe is being dispensed from pharmacy. And you can see that in this example chart with illustrative data, the minimum recommended and minimum programmable flow rates differ according to syringe size and brand. So you can't just substitute the same size or similar size of a syringe from a different manufacturer and expect the same performance. And this can certainly be a challenge during syringe shortages. An important concept in achieving the minimum recommended flow rate is to use infusion concentrations that will usually achieve or exceed the minimum recommended flow rates for most of the doses that you use. And the ASHP Standardized for Safety Initiative and the Vermont-Oxford Neonatal Network both provide recommendations for standardized concentrations. And I really like the statement that the Vermont-Oxford Neonatal Network includes at the top of their table 2, which reads, organizations where care is provided or anticipated for patients weighing less than 500 grams should consider prospective technology built around these concentrations, aligning the EHR, compounding software and tools, and smart pump libraries. And I feel that this is intended to encourage practitioners to implement strategies that support the clinician's ease of use when selecting a concentration. Okay, so let's practice determining which syringe brand and size we should use for a specific flow rate. So in this case, you have an order for a continuous infusion of a vasoactive medication that is calculated to run at 0.05 milliliters per hour based upon the dose and concentration. So which size of syringe should the medication be dispensed in? Should it be dispensed in syringe brand A, size X, syringe brand A, size XX, or syringe brand B, size YYY, or both A and B are appropriate options? So you can put your answer in the chat. A couple minutes to sort of read through that. So as you're deciding which syringe it should be dispensed in, the first thing to decide is, should this infusion run at or above the minimum recommended flow rate? So in this case, as we mentioned previously, this is a vasoactive continuous infusion, so the answer is yes. So we should concentrate then on the minimum recommended flow rate column, and we don't even need to look at the minimum programmable flow rate. So if our desired rate is 0.05 milliliters per hour, we want to look for the minimum recommended flow rate that's below the rate of 0.05 milliliters per hour. And so if we look at this column here in the chart, we can see that the minimum recommended flow rate is less than our desired flow rate only for syringe brand A, size X, and syringe brand A, size XX at 0.04 milliliters per hour. So the correct answer, which most of you entered into the chat, is D, as both syringe brand A, size X, and XX have a minimum recommended flow rate below the ordered rate. And we will talk shortly about how to decide which one to use then when you have two options. Are there situations where you may need to infuse below the minimum recommended flow rate? And there are. So obviously, if it's not a continuous infusion of a medication that is not high alert or vasoactive, that might be one situation. Medications that are being titrated to effect or are being titrated off and the patient is being monitored might be another option, but that would be up to the clinical judgment at the time of that infusion. And then any amount over time or volume over time infusions, even though those tend to run faster, they are programmed and delivered for that exact amount. So with picking syringes, it's not a one-size-fits-all situation, although there is sometimes a desire to standardize to one syringe size, often a larger syringe like a 50 or 60 milliliter syringe, to simplify dispensing and reduce syringe changeovers. There are some good reasons not to do this across the board. So you should use the smallest syringe size possible. Small syringes have less diction, that plunger is going to move faster, and as we mentioned, they're less compliant, so that medication will get to the patient faster. Now, in our previous example, if syringe brand A size XX and X are acceptable, how do you decide which one to use? So if size X is a 1 milliliter syringe, you might not want to use that because the plunger of 1 milliliter syringes are kind of flimsy and they can even bend in the pump during administration, or that plunger could fall out during transport. So 1 milliliter syringes sometimes can be a bit of a challenge, but you have to balance that against how frequently you decide that syringes should be changed over. Because when you change over a syringe, it can introduce the risk of infection each time that system is open to change that syringe. And you will have to be ready to mitigate any startup delays each time a syringe is changed over. So there will be more to come on these concepts with the next webinar. And then again, just to reiterate, always use a syringe that is approved by the syringe pump manufacturer. You may need to create a chart like this for medication infusions. And so here we have a drug at a specific concentration. And if you dispense that drug in more than one concentration, you might need to create a chart like this for each concentration. We have the common weight-based doses in the first column, and then we have the resultant rate in the second column. And then you can construct the chart by using the minimum recommended and minimum programmable flow rates to guide the decision on which syringes are preferred. So these green areas represent the recommended syringe sizes because the ordered rate will achieve the minimum recommended flow rate. And then any yellow areas represent the rates below the minimum recommended flow rate. So this is an instance where you would need to use some clinical judgment based on the things like we discussed before about whether or not it's a vasoactive infusion, for example. And then the red areas indicate that that syringe size should not be used because the ordered rate is at or below the minimum programmable flow rate. So think about any ways that technology can automatically support syringe size decisions based on concentration and rate when possible. And also think about how will nurses know which syringe to select if they're drawing up medications for continuous infusions in their areas. So let's take a couple of minutes here to consider occlusion alarms. Often upon configuration of smart pump drug libraries, pharmacists question which settings to use for occlusion pressure detection. And this is a good area for pharmacy nursing collaboration. And when deciding on those pressure settings, weighing the risk and benefit of frequent alarms versus interruption of flow. And the FDA safety communication that I previously mentioned addresses occlusion alarms and states that the goal is to decrease the time to trigger an occlusion alarm. So one way to do this is to use low pressure settings. However, you need to balance that with decisions regarding the properties of an infusate. So for example, if you're infusing a thick fluid like enteral nutrition or lipids, you might want a higher setting so you're not getting constant alarms. Decreasing the time to occlusion can be accomplished by getting the drug or the fluid to the patient quicker, and that can be done by using small syringes or, again, priming from the pump. And you should use accessory devices with the smallest internal volume, which is also called dead space. And this minimizes that residual volume between the syringe and the patient at low flow rates. And you can accomplish this by using small bore or micro bore tubing, shorter tubing length, and then minimizing dead space of inline filters. So some pharmacy strategies then to ensure flow rate consistency in summary. Aim for concentrations that achieve that minimum recommended flow rate as often as possible, but especially when you're using vasoactive infusions or infusions with short half-lives, etc. Select the appropriate brand and size of the syringe for the flow rate, referring to your operator's manual to determine which syringe has been approved for your syringe pump. Determine appropriate occlusion alarm settings in conjunction with your nurses. Standardize the placement of medication labels on syringes so they don't impair the ability to appropriately load the syringe, but also make sure that that label does not obscure the markings on the syringe so that the nurse can select and confirm the syringe size when loading the syringe into the pump. And you should also be familiar with administration set accuracy, as certain components and materials of administration sets can affect accuracy. So what can you do after this webinar and before the next webinar? As a pharmacist, are you dispensing the appropriate brand and size of syringe based upon the type of infusion, the minimum recommended flow rate, and the ordered flow rate of the infusion? Are labels applied to syringes in a standardized format so as not to impede proper loading and visualization of the syringe? Also, maybe take a poll of some of the nurses that use syringe pumps and ask them, do they consistently prime from the pump prior to starting syringe pump infusions, specifically continuous infusions? Can nurses describe situations where they felt like the patient might not have been receiving the medication? And if so, are nurses familiar with what the minimum recommended flow rate is? Do they know if they receive alerts from the pump if they attempt to program a rate below the minimum recommended flow rate? And do they know if they get one of those alerts, what should they do in response? So in May's webinar, we're going to talk about nurse or other end users, such as anesthesiologists, strategies to ensure flow rate consistency. And these are some of the topics that will be covered then. And you probably notice that there is some duplication, and that's intentional. And my MSL colleague, Jennifer White, will be presenting that webinar. And Jennifer is also a neonatal nurse, so she'll be bringing to the presentation not only her expertise in the area, but her experience as well. So if you would take a moment to please scan this QR code to begin the survey, and you can do that while we begin the Q&A component of the webinar. And I've also included my email address here should we run out of time for questions and answers, or if you have questions that you just want to directly email, and that would be great. So Debbie, I think we can go ahead with the Q&A.
So thank you so much, Jackie, for all of that. That was a lot of information in a short amount of time. But I think kudos to you, very, very well presented. So as we await for all of the questions to come in, some questions that we received earlier. So you mentioned that the FDA safety alert came out in 2016, yet we're still talking about this very important topic. Any thoughts on why we haven't seen practice changes as a result of the 2016 FDA safety alert?
I think that it's possible that back in 2016, there may have been changes made at the time at individual institutions as a result of the communication from the FDA and perhaps even from syringe pump manufacturers. But over time, as staff turns over and we've had changes in the healthcare landscape, some of that knowledge may not be as available or as known, particularly to maybe newer nurses, newer pharmacists, et cetera. So I think it's just a matter of probably needing to reiterate that because, as I mentioned, that information is still pertinent today.
Yeah, I agree with you. I think that uh, healthcare and pharmacy practice has changed so much in 10 years with just how much we're relying on our electronic health records and how we're standardizing those. And so definitely an area where we have some opportunities to re-educate and remind folks on best practices. Question in the chat. So lots of questions on syringes, which of course is a very important topic for syringe pumps. You mentioned that there are some backorder issues with syringes, and I think that was very prevalent in recent times. And the importance of using a characterized syringe. Could you elaborate on what these folks, perhaps some mitigation strategies or some considerations, if that back order happens on that Friday afternoon, what should they do? How should they kind of tackle that? What are some things they could think about?
I think some of the things they can think about is that hopefully within the space where the syringes are being dispensed for the syringe pump, so in the pharmacy where the medications are being drawn up, that they are only stocking those approved syringes. I think it's also helpful in many instances to have a backup brand available to you that it's approved for your syringe pump. And then if it, again, is a Friday afternoon type of situation, taking inventory, knowing how many days of syringes you have on hand based on your utilization, perhaps ordering more if possible, and or obtaining syringes from other areas of the hospital that would also stock those approved syringes. Any other ideas, Debbie, you can think of?
Those are great idea. Of course, you may want to reach out to your drug library pharmacist. Maybe there's some optimization settings that can be done within the pumps. And then as you're collecting those characterized syringes, as you described, Jackie, trying to make sure those are prioritized for the most critical infusions, of course, would I think be another suggestion I might have.
It's a good one.
There's a question in the chat, and so this is a non-promotional education, so I don't think we want to discuss any specific features of any devices, but there is a question about how the pumps automatically select the right syringe size. So maybe we could talk about that in general, perhaps.
Sure. And Debbie, maybe I will defer that question to you if you would like to speak a little bit about those characteristics. It's a little bit outside of the topic for today, but I think it warrants being described.
Sure, absolutely. So syringe pump manufacturers include metrics from each of the syringes that are characterized, and those are included in the pump. And as the syringe is loaded into the pump, there are several sensors on typically any syringe pump that will assess the external barrel diameter and some of those others. And that is how the syringe pump will detect the size of the syringe. Typically, the end user will need to confirm that what the pump is sensing is correct, right? To be that independent double check at the bedside. And as you can imagine, a lot of syringes are very similar in size, and so it is very important for the user to correctly identify that syringe, or else, again, we will not receive that flow rate accuracy. So great question. Thank you for that.
And I think that also supports the need for standardizing your label placement so that the nurse can very easily look at that syringe, see those demarcations and any other identifiable parts of the syringe, and be able to confirm the syringe that's being identified by the pump.
Yes. Want to make sure those labels are not in between the pump and one of those sensors that will cause an error in the reading for sure. Well, I don't think we have any other questions unless folks want to add those into the Q&A here at the end. But maybe we can talk about where they can find this and review this in the future, Jackie.
Yes, thanks, Debbie. So as I mentioned, both of the webinars will be recorded and uploaded onto our educational website. You can share that with any colleagues who weren't able to attend today, and it will be available probably within the next week or so. And with that, I would like to thank everyone for today's attendance, and I hope that we see you at the webinar in May. Thank you, everyone.
Thank you.